Between African Americans and white people, there are a number of health disparities. Heart disease, diabetes, and stroke are among the illnesses that doctors frequently see in young African Americans. Socioeconomic factors significantly affect how African Americans are able to prevent and cure certain disorders, even though genetics may occasionally play a role. If you are tuning in now, please like, comment and subscribe for more videos on our road to 1,000 subscribers. Thank you to all who have subscribed so far. In this video, we will be outlining 7 different ailments that seem to take the African American or people of color by storm. 1. Heart disease. The leading cause of death in the United States is often heart disease. Heart disease rates among white Americans have been gradually declining since the 1970s, but they have not been declining as quickly among African Americans. The problem, according to the statistics, is not that African Americans have a higher rate of heart disease, but rather that their chances of surviving a cardiovascular event are worse than those of other populations. In actuality, compared to other Americans, African Americans aged 18 to 49 had a twofold higher risk of dying from heart disease. The Affordable Care Act, which was approved by Congress in 2010, increased all Americans' access to healthcare insurance. Although it seems that African Americans' access to cardiac care has increased, there is still a discrepancy. Generally speaking, this demographic experiences worse outcomes than their white counterparts because referrals for potentially life-saving procedures like cardiac catheterizations are delayed. 2. High blood pressure. High blood pressure is one of the risk factors for heart disease. This illness, often known as hypertension, is particularly problematic for African Americans. In actuality, 1 in 3 African Americans experience hypertension. Without proper access to care, high blood pressure is challenging to control. Compared to non-Hispanic Caucasians, African Americans are less likely to have their blood pressure under control. Moreover, African Americans often have substantially higher blood pressure values and acquire high blood pressure early in life. 3. Cancer. African American men are 50% more likely than white men to develop lung cancer, and more African American men have conditions such as enlarged prostate and prostate cancer, despite the fact that cancer is the second leading cause of death for all races. Yet regrettably, more African American men die of cancer than people of any other race. A 42% higher rate of death from the disease affects African American women under the age of 35, whose rates of breast cancer are 2 times greater than those of Caucasian women of the same age. Poorer outcomes are a result of limited access to care, which exacerbates these trends. For instance, if cancer therapies like chemotherapy are not started promptly, the disease advances more quickly, resulting in more problems and a higher fatality rate. In fact, young African American women are 3 times as likely to die from breast cancer as young Caucasian women. 4. Diabetes. African Americans, who are almost twice as likely to be diagnosed with the disease as non-Hispanic whites, should also be concerned about diabetes, or high blood sugar. In addition, diabetic complications include end-stage renal disease and lower extremity amputations are more common in African Americans. 5. Stroke. Also, African Americans are disproportionately affected by vascular illnesses, which damage your arteries and veins. More than any other racial group, African Americans experience strokes, and they do so at a younger age. Regrettably, if they survive a stroke, they are twice as likely to die from one as Caucasians are, and if they do, they are more likely to become crippled and have trouble performing daily tasks. Stroke risk factors include high blood pressure, diabetes, sickle cell anemia, smoking, and obesity, all illnesses that are common among African Americans. Nevertheless, the causes for this gap remain unclear. 6. Peripheral arterial disease. 1 in 20 people over the age of 50 suffers from peripheral arterial disease, PAD, a disorder that arises when your arteries get blocked with fatty deposits that can restrict circulation. African Americans experience PAD more frequently than any other race or ethnic group in the U.S. Again, this could be attributed to risk factors. As was previously said, diabetes and high blood pressure are more prevalent among African Americans and increase the chance of having PAD. The risk of a heart attack or stroke rises as a result of PAD. 7. Sickle cell illness. Sickle cell disease, a group of genetic red blood cell diseases, affects only a very small portion of people. Compared to African Americans, who are more likely to develop the condition, 1 in 500, white people rarely do. The National Institutes of Health estimate that over 90,000 individuals are affected by the illness. When the body is healthy, circular red blood cells transport oxygen throughout the body through tiny blood arteries. Yet in someone with sickle cell disease, these cells harden and become sticky, resembling the sickle, a C-shaped cutting tool. Red blood cells are constantly in short supply because sickle cells expire quicker than healthy cells, anemia. Moreover, sickle cells become stuck as they move through blood channels and stop the flow of blood. This can result in weakness, pain, and other severe problems like infection, kidney disease, stroke, or acute chest syndrome, a condition that can be fatal and brings on symptoms like fever, chest pain, and breathing problems. Sickle cell illness can actually reduce life expectancy by up to 30 years. A bone marrow or stem cell transplant, which removes healthy red blood cells from one patient and gives them to a person with sickle cell disease, is the sole treatment option for sickle cell disease. The bone marrow produces fresh, healthy cells as a result of these healthy stem cells. Unfortunately, these transplants are costly, dangerous, painful, and can have negative side effects. To find better treatments, more money and research are required. Not a lot of state or federal resources are dedicated to researching this disease. How can this trend be changed? Illness prevention is more simpler and less expensive than illness treatment. Regardless of color, Americans should take charge of their health. You can take efforts to guarantee that disease can be detected and treated at its earliest stage by receiving regular preventive health screenings including blood pressure, blood sugar, and cholesterol tests, age-appropriate screenings like mammograms and colonoscopies, and an annual physical exam. Establishing a baseline for your present health state to compare to the findings of future tests requires maintaining a relationship with a primary care physician. Thanks for watching.